Good morning and welcome to this very special milestone of our endeavor towards building of healthy India by ensuring healthy women and children. Today we are here to dedicate the Janani Helpline that has come to existence with the labor of love from committed members of IHW Council, Artists for Her and Project StepOne. With this helpline, we are going to take a momentous step towards bringing health equity at a time when a pandemic is ravaging our lives. It is often said that God could not be everywhere and therefore he made mothers. However, when we look at the mothers and expectant mothers around us, especially those living away from the cities, we find many of them struggling to access some of the basic needs such as information, care, or empathy. Women are also at the receiving end of gross social inequity that has impacted their health and well-being to an extent that we find more than half of our adolescent girls, pregnant women, or breastfeeding mothers are anemic, a condition mainly contributed due to malnutrition. And all that has only further aggravated during the ongoing pandemic, with many of these women hardly have any access to healthcare and look for some support to address their concerns related to problems as basic as use of contraception or menstrual health to issues related to pregnancy. And I'm happy that we are launching this helpline that will try to address all these concerns in multiple languages. And we are launching it in the presence and they being in the audience today with us of purpose driven doctors and women health experts who are going to be the real power behind this helpline. These doctors have assured us that the pledge that we took on 24th of January this year on the occasion of National Girl Child Day with the initiation of Shapath 1000 days to work towards bringing meaningful intervention for promoting the health of our women and children will certainly be fulfilled. This will help us strengthen the very foundation of building of a healthy nation. And it will happen not because we are moving towards this direction, but because hundreds of these committed volunteers who are leaders in their own rights are walking with us. So let me welcome each one of these women health crusaders who have joined on this program, and also welcome my comrades in this journey, Dr. Hema Divakar, CEO of Artists for Her, the former president of Foxy and present ambassador to FIGO. Mr. Raghavendra TS, the founder and chief volunteer of Project StepOne, a concept that has helped most number of people suffering from COVID-19 in our country. Dr. Suchin Bajaj, founder director of Ujala Cygnus chain of hospitals that is serving poor and missing middle class of our population with 15 tertiary care hospitals across North India. His commitment to serve the community is so deep that along with running these chain of hospital, he's also on the forefront of COVID management in Delhi and is actively serving the larger population through Project StepOne. And also Dr. Ekta Bajaj, who has been instrumental in managing this and making this helpline come to the existence. So thank you everyone, and a big thank to the energetic and inspiring community of 150 specialists, gynecologists and obstetricians who are going to be the heart and soul of this helpline. So with this, let me welcome all our guests in this session when we are going to launch this helpline formally. And let me begin with Dr. Hema Divakar, that Dr. Divakar, how do you and how excited you are about the launch of this helpline, which is certainly a labor of love for you And I have been seeing you, kind of convincing, bringing together a lot of doctor to join, to, kind of become the part of this voluntary movement. And so the kind of, the people's power, the professionals' power to bring health care or the support which is much needed for a large population of our country. Dr. Hema Devakar.
Namaste, Kamalji. And to Suchin Bajaj's mother, the Janani of this great man, on behalf of everybody viewing this, we wish you a very, very happy birthday and a happy innings for the rest of your life. So that was first things first. On this World Environment Day, it was our Shapath, or 1,000-day journey towards making the environment the best ever possible for the girls and women in our country. So, in the typical philosophy of Kamalji, myself, and the rest of the team who is here, connect and collaborate has always been our endeavor. And a long journey has to begin with one step. And who else could it be but step one? Raghavendra, Derek, Abhishek, and the team who have so kindly joined this endeavor and supported us. And as we always say, and now everybody has come to believe that this is the era where the healthcare and the technology have to marry each other. And what better could be the development with all of us being very passionate, very purposeful, very enthusiastic, but how to take that first step? That was where Rags and his team joined hands to say, here we are and we can make things happen. And Suchin Bajaj and his better half, Ekta, who belongs to our community of women's healthcare specialists, we put together hundreds of our champions, some of them whom you can already see have joined us, and many more out there who also have a key element in their minds when they're treating the patient. Oftentimes we think, oh, I wish she would have come to us earlier. I wish the action would have been taken on time. I wish she had better access to information, this, that, and the other. Here is our opportunity to reach out very proactively, because Artist, as which expands as Asian Research and Training Institute of Skill Transfer, I have always said that art of artist is the key, and the ART of artist is very well aligned with the Janani which we are launching today, the helpline, because A is for advocacy. Advocacy of the peer group is what we have been doing as a Foxy community. But what is the use if we discuss, debate, and fiercely, set our best practice recommendations right within the four walls of our own community? Where and how does it reach the girls and women out there? So this advocacy through the Janani Helpline, where we are just one call away, and any girl, any woman in any part of the country, and the beauty being English, Hindi, Kannada, and Tamil, she can be spoken to her by the specialist in her own language, so that the gap in understanding would be minimized. The A for advocacy, the R for research. How does research align into the Janani launch? Well, a lot of data that we would capture through a variety of calls that we would get, we will know where to focus our next step. Because what are the trends of the problems? What are the women wanting to ask all the time? What is it that's bothering them? What are their myths and misconceptions? Once we get that clarity, we will be able to invest our time and energy in doing better for our girls and women. So that is the observational research component, which can move ahead into a variety of contextual betterment of the health of our own girls and women. Lastly, the T, the training. Yes, the set of champions that we have with us here today don't need any training, because they're all the specialists who are wonderful in their own merit. But when thousands and lakhs of women start getting on to our helpline, we need a filter in between. We need to create a whole new cadre of human resource, as in the counselors, because we want to avoid the bottlenecking with every call going to the specialist. Because, dear friends, we are only 40,000 OBGYN specialists in the country. That's a big number if you see in the world over, because Foxy is the biggest organization in the entire world of a specialist community. Having said that, how can 40,000 gynecologists address a subset of 30 million pregnant women every year, and many more, 330 million adolescents, and many more who are now living their life well into the menopausal age? So we need the first filter of counselors. So the training and capacity building of the counselors as we move ahead will also happen well into the Project Janani. So once again, placing my heartfelt thanks, first of all, to Kamalji and his team at the IHW Council. Integrated Health and Well-being is trying to integrate, bring us all together on a common platform for the well-being of the whole community in India. Secondly, our associates with StepOne, who bring in the technology, and Suchinji and Ekta have been in the forefront trying to connect us with the StepOne team. So many thanks to them as well. And last but not the least, we remain ever inspired and ever enthusiastic only because of our champions who have joined hands with us. Because it's always said that if you dream big and you think you can do it alone, then your dream is not big enough. Because to make the big dream a reality, you need a big bunch of people with you. And my very heartfelt, sincere thanks to hundreds of gynecologists who have already joined and thousands who will join us in our Shapath endeavor, a journey of 1,000 days, our resolve to make this world a healthier and a happier place in the near future. Namaste, and thank you for the opportunity.
Thank you so much, Dr. Hema, and let me, congratulate and place our very deep gratitude for helping this endeavor come into the existence. And I'm sure, as you have mentioned, that this is just a beginning of a journey, and the dream is definitely is much larger than what we see it as of now. And the dream is to ensure that this important support of healthcare, of right kind of counseling, a hand of empathy can reach to as many women and children as possible in our great and large nation. With this, let me invite Dr. Suchin Bajaj. Dr. Bajaj, you understand the lacks and gaps of in our healthcare system. And definitely when it comes to women, as I said, that the health inequity is definitely something which play a very important role. How do you see that this helpline is going to make an important difference in terms of ensuring the reach and then the availability of right specialist guidance for our women across the country, irrespective of cities, villages, urban or rural, or even the language barriers?
Thank you very much, Kamalji, and my heartfelt and sincerest gratitude to you and Dr. Hema Divekar, Raghavendraji, Dr. Ekta, and the entire team of IHW Council, Artists for Her, Project StepOne, and all the champions that we have on the call today. I think this helpline is the need of the hour. We have seen in our country that more than 6 crore people slip below the poverty line just due to healthcare costs every year. And the number has, I think, shot up to more than 20 crores in this last year of darkness and madness that we've seen. And we are really hoping that we will not see the days that we've seen in the last month ever again in our life. but that will only depend on us as healthcare providers, as doctors, as workers who are working with the healthcare communities, to make sure that we are ready to serve and to make sure that everyone has access to good quality healthcare. And that is what I think Project Step One is all about. It is about the fact that no one should have denial of healthcare access due to financial or geographical reasons, and that is exactly in consonance with what Ujala Cygnus hospitals also do. Step One is like an online charitable hospital which is providing free care to everyone, and the Janani Helpline is one of the biggest initiatives I think that we have all taken, because if you take just the women of our country and assume that they're a separate country altogether, which will be like a huge country in itself, the population, we will have by far the worst healthcare indicators in the world. It is shocking. We will have worse healthcare indicators than even sub-Saharan Africa if only the women were to be taken as one country. So healthcare, it's not just that we are underserving healthcare. Even the access of healthcare is very poor. Women are very, um, uh, they're not very eager to reach out to healthcare providers. They're very shy of discussing their issues, even with their spouses. They don't really want to tell them that, please take me to a doctor. They just bear everything themselves. So having this helpline in which they feel that they can call up and a wonderful doctor like Dr. Hema Divekar will answer them and they will get to talk to her. I think even with just her smile, 90% of the women will be fine after that. They won't need any treatment. So if women are ensured of the fact that they will be able to talk to a qualified, empathetic doctor when they call someone, they don't need to really spend a whole day visiting a doctor. That healthcare access in itself will ensure that they are taking so much better care of themselves. Their conditions are diagnosed well in time. They don't come to us with complications, and we don't tell them that now your disease is way past what could have been done say 6 months earlier. So these are the things that I think we need to ensure, and our champions, I am sure, will be helping to diagnose the diseases early on, to make sure that preventive care is laid much more emphasis on than curative care. Unfortunately, 87% of our healthcare spend in India is right now on just on sick care. So rest, the primary and preventive care is absolutely, there is no one to look at it because no one is incentivized to look at it. Doctors main purpose is when you fall sick, you come to me and I will treat you, and that is, my livelihood. But the community's purpose is that they should not fall sick at all, right? So being healthy is something that we all need to incentivize our population, our communities. We need to educate them on how to have health positive behavior rather than sickness seeking behavior. And I think Janani Helpline will play a large role in improving the women's health in our country. And many congratulations to all of us here who are involved in this. And I think this is the best birthday present I've ever got in my life. So looking forward to working with you all together on creating this wonderful, wonderful opportunity of treating and securing health of our women.
Thank you so much, Dr. Bajaj, and wish you a very, very happy birthday again. And I'm sure that as you will move into the new year of your, remarkable life journey, you will be able to bring a lot more support, care, empathy for so many people around you. And I must tell that, you mentioned that doctors, have been primarily working that, once you fall sick, you can go to a doctor and you can get the sick care. But I can very well vouch that at least these 150 doctors who have joined this Janani Helpline kind of have broken ranks from that mentality and are ready to proactively help women who are in any kind of distress. And the horizon of this helpline has been kept that even if they are having just apprehension related to a disease or some medical condition, or maybe something which is happening with their body, they can reach out to this helpline, and the specialist doctors will be helping them allay their fears. And as you said that just empathetic voice and kind of that virtual touch itself can cure a lot these women who need this care. So thank you so much, Dr. Suchin Bajaj, for being a very, very important pillar of strength in putting together this entire endeavor and effort. Let me now invite Raghavendra Prasad, a man who I think is making so much impact on the lives of the people across the country. And no matter whether you are living in Delhi or you are living in Bangalore or maybe in Calcutta, you are being touched by, or your life is being touched by something which was a brainchild, or maybe a collective brainchild, among which Raghavendra played a very important role. This StepOne, the project StepOne, and the whole thought about starting this dedicated women health helpline also is kind of a surrogate idea which we picked up from StepOne, with what you are doing for COVID. Why can't it be done for women's health across our country? So Raghavendra, how do you feel about bringing something which is, as Dr. Bajaj said, that it is an intervention which is not an emergency intervention. It is something which is long due. And, if it goes well, the way we, are putting our effort and we expect it to be reaching to its, kind of milestones, I think it's going to be an important, attempt towards helping so many unserved women and, child across our country. So how do you feel about, bringing this effort together or for the help of the people? Raghavendra.
Thank you, Kamalji. Feeling extremely privileged to be part of this initiative. Thanks to you, Dr. Hema, Dr. Shuchin, Dr. Ekta, and so many champions here to have come up with this this idea or this initiative to help the women in the country. I think women are the pillars of any successful society, and women's health is the cornerstone of a thriving economy. And we are right now, aspiring. We are a country which is aspirational. We have both at the leadership level, we are aspirational. At the people level, we are an extremely young and ambitious country. We have set aside very, very lofty goals of becoming a 5 trillion economy and things like that. There is no way we will reach any of those goals without women and women's health being taken care of. I think as a society, we are making strides in women empowerment, I think, but we have not adequately backed up those strides with adequate healthcare for our women. And it is definitely a long due initiative or long due. I feel also we are all lucky, that we are living in times where every woman can potentially, or almost every woman can be reached personally, one-to-one, via the telephone and via the internet, right? I think I don't think ever before in the history of civilization we could have had this kind of an opportunity where everyone can be reached and reached in a very meaningful way. And thanks to the initiative of Dr. Hema, so many people, so many champions, so many gynecologists and obstetricians have come forward to use that opportunity to show to the world that empathy and kindness, we can use the technology to not only to make money, but to bring empathy, kindness, and bring better health outcomes to the women. And I think I should also congratulate once again all the women champions who have joined us, who are going to be extremely occupied, and there'll be a lot of learnings for all of us. This is a journey. It is not a milestone. I hope we'll have many milestones because of this journey that we have undertaken. And as Dr. Hema very well put, the 1,000-day journey is going to bring us many milestones. And I really love the way Dr. Hema has talked about the Shapath and the 1,000-day milestone. If all of us can dedicate ourselves to this cause for 1,000 days, then I'm sure we'll bring about a sea change in the women's healthcare in the country. I'm extremely confident, because 1,000 days and so many committed, talented people working to make it happen, it will definitely happen. I should also take this opportunity to thank all the volunteers of Project StepOne, because Project StepOne is a volunteer-led organization. We have we all of us are doing what we are doing only because we believe in it, and I think we are so happy to welcome Kamalji and IHW Council have always been helping Project StepOne, but it is great to welcome Dr. Hema and so many champions of Foxy into the fold. At the end of the day, we are all a virtual organization, and we are all connected together towards the same cause. I should thank Derek, Abhishek, Vidya Shankarji, and so many other volunteers who have worked tirelessly to make this happen in a very short time. I think and we will continue to keep evolving and improving the whole system so that we are able to bring better and better care to the people. So just extremely privileged and really looking forward for the journey and the impact that we can create going forward.
Thank you so much, Raghavendra, and it's absolute pleasure and honor and privilege for us at IHW Council also to associate with such a wonderful real impact makers in the area of health. You through StepOne, Dr. Suchin Bajaj through StepOne, as well as Ujala Signals chain of hospitals, and Dr. Hema Devakar with a lot of seminal work which she does across the country. It is not that Dr. Hema Devakar is just in Bangalore. I think she is almost at every part of our country through some representative who live with the same cause and objective to bring health to the people. So thank you so much, all three of you, and Dr. Ekta Bajaj also. I will be coming to her as a important closing remark. But before that, let's say the moment which we all have been working for or waiting for, the launch of Janani Helpline. And I again would like to underline that this launch is much more ceremonial and important for us and for all of the people, because normally we get launches done through some ministers or dignitaries, but here the biggest dignitaries are each one of you. All are champions, and all those champions and volunteers who have not been able to join us on this Zoom call, but maybe watching us on our live platforms, or maybe watching it later, because this is you who bring the real difference when it comes to bringing health care to the people of this country. And that is why your being in this launch is much more important and momentous than anyone else. So with this, I would request my team to just, through some virtual medium, let's mark the beginning of this much awaited, much needed helpline, created with love and a lot of care, the Janani Helpline.
जननी महिला स्वास्थ्य हेल्पलाइन में आपका स्वागत है। यह हेल्पलाइन सिर्फ महिलाओं के लिए है। यहाँ आप हमारे विशेषज्ञों द्वारा अपने सभी स्वास्थ्य संबंधी प्रश्नों के उत्तर प्राप्त कर सकते हैं। आपका आयु वर्ग क्या है? अगर आपकी उम्र 20 साल से कम है तो 1 दबाएं। अगर आपकी उम्र 20 से 40 साल के बीच है तो 2 दबाएं। यदि आप 40 वर्ष से अधिक उम्र के हैं तो 3 दबाएं। क्या आप अपनी समस्या के लिए कोई दवाई ले रहे हैं? हाँ के लिए 1 दबाएं, नहीं के लिए 2 दबाएं। क्या आपको मधुमेह या रक्तचाप है? हाँ के लिए 1 दबाएं, अगर नहीं तो 2 दबाएं। क्या आपके पास गर्भावस्था से संबंधित प्रश्न हैं? हाँ के लिए 1 दबाएं, नहीं के लिए 2 दबाएं। अन्य स्वास्थ्य संबंधी प्रश्नों के लिए 2 दबाएं। पुष्टि करने के लिए धन्यवाद। हमारे विशेषज्ञ जल्द ही आपको कॉल करेंगे। जननी महिला स्वास्थ्य हेल्पलाइन में कॉल करने के लिए धन्यवाद।
मुझे खुशी है कि आज IHW की ओर से कमल नयन जी ने कहा है कि जननी हेल्पलाइन भी हम शुरू करेंगे। अच्छी बात है। 5 ऐसे जगहों से आप जननी हेल्पलाइन शुरू करने वाले हैं। मैं इसके लिए भी आपको शुभकामना देता हूँ। आपकी संस्था को, आपके समस्त जो टीम है, आपके सभी टीम वर्कर्स को भी मैं बधाई देता हूँ।
So thank you so much. This number 9739693300, this should become the very important part of every woman's phone directory. It must be saved, and we all need to, after launching this helpline, all our volunteers, all our team members, all our well-wishers, and the institutions which are associated with us. And there are so many of them, Artist for Her, Project StepOne, Ujala Signas, and each and every champion who is associated, who has dedicated her precious time for this cause, are also running some sorts of institutions at their respective areas and cities and regions. And I request all of them to work towards ensuring that this number 9739693300 reaches to every woman, so that it can be used at a time when they need it, and they can get to hear some consoling words and expert advice from our specialist doctors related to their health issues. With this, I would request now Dr. Ekta Bajaj. Dr. Bajaj, this is kind of a collective brainchild, and the child is out there now, is smiling and kicking. What is your reaction, and how do you feel how it is going to help in achieving what we have envisioned? Dr. Ekta Bajaj. I think there is some connection problem with Dr. Bajaj. Dr. Ekta, you are there? Okay, so in between, by the time Dr. Bajaj comes back on the call, Dr. Hema, since it's a women helpline and you are, the one important pillar behind it, now it has been launched. Any word you would like to add on?
The reflections at the moment is, oh, this is something that we could have done long, long ago. But being a diehard optimist, I think the second best chance was here and now, and we have done it. That's what I feel, because, there hai and there nahi kind of a situation where all of us, this is a very special moment, because the COVID times has encouraged us to go digital, and everybody's mindset is recognizing the power of technology. And so this is something that is here to stay, and we will be the happiest. And I'm speaking on behalf of each and every one of my champions out there, that they are always with the mindset of wanting to do and wanting to do more. So I congratulate ourselves for actually translating our thoughts into action, and maybe never look back that we missed the opportunity to do something so useful to every girl, every woman out there. Thank you so much again to everyone who has made this initiative a reality, and I'm very, very sure that we will have very rich experiences and very satisfying moments as the day goes by. Days go by, and 1,000 days will be soon covered, where we'll be embarking on something even more, even better through newer thoughts, newer technology, more action. As I said, we are unstoppable. Thank you.
Yes, so we are unstoppable, Dr. Hema. Thank you so much. Dr. Bajaj, there was some connection problem. You're back.
Yeah.
So your response to this, the big endeavor which has come to the existence with the help of all of you, Dr. Bajaj, how do you feel about it now?
Yeah, I really feel excited about this project, Janani Helpline, and thank you so much, Kamalji. You have always been passionate advocate for doctors' causes, and you have been the backbone of Janani Helpline. There is a lot of noise in the background.
Dr. Bajaj, it is coming clear. I think there may be some specific. You can continue. Yeah.
Yeah. And Kamalji, you took care that every point should be taken care of personally as far as Janani Helpline is concerned. Thank you so much. And big thanks to my dear Hema ji and Janani of Janani Helpline. You know, I remember exactly 1 month back, you got this idea and we talked about it. And see, just after a month, in a month's time, and it is a launch time for Janani on 5th June. And Janani is her baby, and she's very passionate about it, and she is great inspiration for all of us, you know, in just 1 month's time. And she make it a reality. And big thanks to Raghavendra ji and team StepOne. I have very closely seen they have been working tirelessly for COVID patients. It has been more than 1 year. And now Janani Helpline, they are helping a lot as far as technological support is concerned, and arranging helplines. Thank you so much, Raghavendra ji. And big thanks to Dr. Shuchin Bajaj for all the medical support and guiding us. And I want to take the opportunity to wish you a very happy birthday today. And Dr. Bajaj has been working tirelessly in the COVID times, and he has been working as core member of StepOne Group, StepOne Project, and also he has been working as the founder and CEO of Ujala Sickness Helpline. And even in the difficult times, he never neglected his family, and he has always been working tirelessly. And the biggest thanks to our volunteers, our champions, and without their contribution, this dream is just impossible. I can understand it has been difficult time for all of us. Every doctor has been busy taking care of patients, family, but they still took out time for the social cause. Thank you so much to our champions, volunteers of Janani Helpline, and I'm sure in future we'll get more volunteers attached to our helpline. And thanks to people who are working in background, Shruti, Derek, and Abhishek. Thank you so much. And I'm really sorry if I forget to any names. And in the last, I would like to thank my patients, and because of our patients we are here. And this endeavor is because of our patients, and they really trust us with their life. And we are trying our best to give them whatever we can in return. And I am really looking forward to Janani Helpline, and let's see how it brings change in women's life in India. I am really looking forward to it. Thank you so much.
Thank you so much, Dr. Bajaj, for your wonderful support and help and a lot of hard work. And just to summarize, we have a lot of champions now, and the next session we will be hearing from them also their views and their purpose for life and why they thought that this is the best way to help the women in need, and which is much more required in our nation. This altruistic way of ensuring medical care. So this helpline is going to be manned or women, sorry, by 150 doctors in 4 languages: Hindi, English, Kannada, and Tamil. And we aim to include many more languages as we go forward, and we aim to get at least 10 Indian languages incorporated and get our volunteer base nearly over 350 plus doctors over the couple of months as we go along, and we see how this helpline is going to help the women in need. This helpline will help all your questions, be it on mental health, prevention, care for anemia, pregnancy care, healthy lifestyle for women, well-being,
background में कुछ चल रहा है,
infant care,
बोल दिया तो ठीक कर दें,
vaccination, and infant health, and general food and nutrition counseling also, without leaving the safety and comfort of your home, with the privilege of just a smartphone. And by saving this number 9739693300, you can access the specialist's advice through this number completely free of cost. And if you have a question, just hit the call button now, and our specialist doctor will contact you to help. And as I sign off to hand over this session to my colleague and media veteran Anisa Nayak Dhawan, let me recite a few lines from Allama Iqbal, which highlights the beginning of this initiative, that सितारों के आगे जहां और भी हैं, अभी इश्क के इम्तिहान और भी हैं, तू साहीन है, परवाज है काम तेरा, तेरे सामने आसमान और भी हैं. These lines highlight we are marching forward, but a lot of distance is yet to be traveled to ensure health for all our women and children, and we will reach that destination for sure, because what we are meant for is to march and march till the end. So thank you so much, and here I sign off. Over to you, Anisa. Thank you so much for joining, all of you.
Thank you, Kamal.
Thank you, Kamal.
And a big thank you to all those who have joined in. This is really a momentous start to the Janani Helpline, a helpline that is going to come to the rescue of all women in our country who need some guidance on their health. This is an amazing start, and we're all very proud of this. Now, the Janani Helpline is a multilingual, dedicated national women's health helpline. It will help and advise women and rural girls in India during the COVID-19 pandemic on pregnancy care, gynae issues, nutrition, infant care, everything. Of course, this is, of course, a natural corollary to our motto that attention to women's health must be a priority. The COVID-19 pandemic has disrupted institutional care for women, especially those who are pregnant and nursing, due to stressed healthcare systems and the fear of contracting the coronavirus. The Janani Helpline will ensure that women always have a qualified healthcare professional to confide in and to get well-considered advice from the privacy of their homes. And how will this transform the lives of women, some of whom have been schooled into believing that suffering in silence to save family the trouble is the sacrifice women must be ready to make? To discuss this, we have a panel of experts joining us who deal with women and their health issues day in and day out, and they're here to tell us what they have seen in their experience and what they feel can be the transformational change that the Janani Helpline can bring through. So please welcome our expert panel of speakers who are joining us. Please welcome Dr. Ekta Bajaj, Senior Consultant and Head of Obstetrics and Gynecology Department, Ujala Cygnus Hospitals. Dr. Archana Verma, Vice President-elect, Foxy, and Founder, Vice President, WET UP Chapter, IHW. Dr. Charmila Avayu, Director, Aditi Hospital and Parvati Avayu Fertility Center, Trichy. Dr. Jayam Kannan, Managing Director and Chief Consultant, Garbha Raksham Vigai Fertility Center. Dr. Komal Chavan, Chairperson, Foxy Medical Disorders in Pregnancy. Dr. Preeti Kumar, Chairperson, Safe Motherhood Committee, Foxy. Dr. Sneha Puyar, Chairperson, Study on Female Breast Diseases Committee, Foxy, and President, ISOPAR Vidarbha Chapter. Professor D.S. Sampath Kumari, Chief and HOD, Muthukumaran Medical College and Research Institute, Chennai. Dr. Sonia Mandappa, Consultant, Obstetrics and Gynecologist, Mother's Care Clinic, Mysore. Dr. Vidya Tovi, Chairperson, Food, Drugs and Medical Surgical Equipment Committee, Foxy. A warm welcome to all of you for joining us today. It's so good to have so many well-known doctors who are doing such a great job in our country. And really, what I want to understand from you is, in your practice, what have you seen about women and how forthright they are about, seeking help when it comes to the healthcare issues. So let me start with you, Dr. Sonia. Do you think that women are quick to seek help when they have health issues? Will talking to a qualified professional on the phone empower women to take the necessary steps to get the right care? What have you seen in your practice?
Good afternoon, everyone. Yes, indeed, it is a nice platform for me to speak about primary health care. See, primary health care relies heavily on the contribution of women, particularly in health education. It raises the self-esteem and empowers them to serve communities in a number of ways. So when I understand empowerment is hand in glove with technology today. 21.7 billion women own a mobile phone, according to the latest statistics, out of which 1 billion women are using internet. So I feel that the empowerment is with the technology, and we go ahead with that.
All right. Dr. Preeti, in your practice, have you seen that women are forthright? They want to come and, quickly discuss the health issues as soon as they, arrive, or do they delay it? And, they may delay it for many reasons. I don't have the time. Why burden my family with healthcare expenses? What have you seen in your experience? Are they prompt? Are they a little lackadaisical?
Thank you so much for putting that question. And first and foremost, I would like to congratulate Dr. Hema Divakar and Kamalji and the entire team of StepOne for bringing this initiative up, Janani, and for which we are all together here. And it's a great launch today. We are all dedicated Foxians, I must say, who have joined today, working towards the health of the women of our country. And I bring greetings from Foxy as a Safe Motherhood Committee chairperson. And trust me and believe me, even if I don't hold any post, I would be there forever for Dr. Hema Divakar. So before taking up that question, I would like to just emphasize few data here. Recently, we had, I belong to Uttar Pradesh, a state where the maternal mortality is really very high. Trying to combat this issue, since I have taken as a charge of Safe Motherhood Committee, trying to connect to everyone with the technology as far as possible. But just to bring you the data from the HMIS from UP, I would like to just highlight that we just lost the follow-up of 3 lakhs pregnant women for the institutional deliveries during this COVID time. So there was a loss of approximately 6 lakhs. The data quote that there was loss of 6 lakhs follow-up of antenatal care, and approximately 3 lakhs pregnant women did not report to the institution. So where did they deliver? What were the complications? And there are so many things to look at. Hopefully, yes, the question that you have raised, some are very comfortable with the technology. They want to take up these with the technology, but still they are not comfortable. They want to have the physical presence also. But definitely this Janani, I must say, I can take that initiative in Uttar Pradesh, that these the gaps in the health statistics in the maternal health are going to be affected a lot during COVID. And with this Janani helpline, we might reach to many those women who could not report to the institution for the delivery or for the antenatal care. And there were also loss of follow-up of because every contact point they were doing the HIV testing also. So UP statistics data code, there were loss of 3 lakhs women who did not report to antenatal, so they could not get the HIV testing done. So a lot of health statistics is affected. I tried to find out the statistics, especially for this program, Janani program, so that I can bring out the reality of Uttar Pradesh. And we hopefully will try to touch on these because aspirational districts have a lot of maternal mortality, and we are working on those. Even the city people can contact us, but for the villages and the aspirational districts, lot need to be done. So thank you so much for involving us in this program, and we will try to do as much as possible for this Janani. Thank you so much.
Thank you, Dr. Preeti. But 3 lakhs, that is an astounding number of women who dropped off institutional care because of the pandemic.
Yes.
Now,
Yes.
this situation may be, not planned for, not anticipated, once in a lifetime, because the pandemic perhaps comes only once in a lifetime. But generally, what are women forthright about their health? So, Dr. Charmila, what have you seen in your part of the world? If a woman is seized of a health problem or thinks that she has a health problem, is she quick to go to the doctor and get it confirmed?
Good morning. I would like to thank Hema Madam for the opportunity. The problem is women do not access healthcare the moment they have a problem. That we see. They try to procrastinate as much as possible, try to do all the local remedies, talk to a neighbor, go through their WhatsApp, go through Google, and then come last to a doctor. And I'm not from a big city. I'm from a small city in Tamil Nadu. We have got good healthcare facilities here. That is, you can contact the government facilities. They got very good ASHA workers working, but still they do not access, and they usually come at the last moment. And in COVID, we have seen that it's become very worse. So when you have a helpline and you tell the patient you contact through this number, we'll give you the proper details. Probably it will work very, very much. I think COVID has created an opportunity so that this program can be taken forward for the future of the healthcare for women folk, especially in a semi-urban and a rural setting. I think it will work out.
Right. Dr. Kannada, could you tell us, since you interact with so many women and they're coming to you rather late in life, rather late in the disease, because they haven't accessed healthcare quickly enough, like all doctors have pointed out. Why is this? Are women ashamed or secretive about their health conditions, especially reproductive issues? And does this anonymity on a phone call, you're calling a helpline, will this help women to be more forthright, more truthful? Will this also impact the course of the treatment?
Anisha, this question is to whom?
It's for Dr. Kannan.
Dr. Kannan, Jayam Kannan.
Yes, Dr. Jayam Kannan.
Madam, unmute us.
Yeah. This question of making these people accept the telephonic conversation depends on whether you are talking to an educated woman of India or middle class educated woman or the illiterate women. If it is an illiterate woman, usually the husband or father or somebody may ask the details, and through a messenger we get the communication, which becomes difficult. If it is a middle class woman, she always thinks of some things which she wants to answer, other things she doesn't take into her mind. If she is a literate woman who has Googled everything, there really it is difficult, because she will always put questions. Madam, I saw that in that Google, but you are giving a different reply. How am I to take it up? So before we talk to these people, we have to find out the mind and the place and the education level, especially in Indian scenario. Depending on that, because we are there in a couple of COVID their systems, where sometimes at the end they say, Madam, I am already in the hospital 10 days and I am asking details. So how do you like it? Then another person who will be asking for a person who is discharged and come back home and for further care. Somebody would have already given them all the details. But these sometimes digitalization, we have to be very careful what we are talking, to whom we are talking, and to how they are going to take it. That is a big question.
All right. Who all go and accept this helpline is definitely an important question. But Dr. Sampath, the question I was asking was that why do women are so secretive about their health issues, especially reproductive health issues? Like Dr. Kannada also mentioned that it is either the father or the husband or a male member of the family who then first will talk about the health issue of the female member of the family. Why this secretive behavior? Why this this thing about not going forth on your own? You may, for different people who have access to information, they may have a different cause. But for regular women, sometimes even educated women sometimes feel a little ashamed about, talking about the reproductive health issues. In your experience, Dr. Kumari, what have you seen? Will the anonymity of a helpline help more women to come forth and be more truthful about their conditions?
Yes, good morning to all. First of all, I thank all for giving me this opportunity from Dr. Hema ma'am. As J.M. Kannan madam told, here every woman, first they will discuss with, as you told, with the husband and the relatives, then only they will come to the doctor. This is not only from the women, even it starts from the adolescent. The adolescent girl, if she is having some sexual abuse problem, she will not come. So with the helpline, it will be easier for her to contact without telling the name and like that. In the reproductive period age also, a woman will be having 1 or 2 children. Accidentally, she becomes pregnant with the 3rd child means, again she will discuss with the family and then only she will feel hesitant to come to the doctor. So with the helpline, they can come at the earlier stages. So we are also for the PCPNDT Act and MTP Act, everything. If they come at the earlier stage, it will be easier and this helpline will be helpful. In the perimenopause and menopause age, again, the women after the menopause, if she is having discharge or bleeding, she will feel very ashamed. And if she is having any mass descending, in that case also, this helpline really will help. So from puberty to menopause, all the problems which they cannot discuss, it will be very, very helpful with the helpline. Definitely the women's health and empowerment, everything will be changed with this Janani Helpline. I again thank Dr. Hema madam for this fantastic idea and all the team who will do the same work with her support. Thank you.
Right. Dr. Puyaj, what has been your experience? Do you think if women like the anonymity of a helpline to be able to talk more freely, do they like to visit the doctor face to face? Is that the preferred mode of treatment? What has been your experience in your practice?
Is it for me?
Yes.
Yeah. Thank you. Thank you so much. A very good morning and hearty congratulations, Hema madam and the entire team. And of course, I agree to what Madam J.M. Kannan and Shapath Kumari has said. Definitely, they are ashamed of, in fact, just all the social and the cultural taboos which prevent them revealing their problems, They won't like to come forward with their problems on their own. If at all they're comfortable with their husband and the family members, they will definitely share with them. And I would say they would need the permission to go ahead and go to the doctor. I don't think the husband, if we consider the reproductive health problems, they're not very keen on that. As if I say like this, as the man has evolutionized, the healthcare also has evolutionized, and it's about the mortality. Previously we used to talk, and nowadays we are talking about the morbidity and the improved quality of life. So similarly, the women have the priorities of their health. You know, if they feel they are going to die because of this disease, so they have that issue on priority. So to this, I would say that reproductive health would come at a very low priority level for the women, and that's the very reason they would neglect it. If at all they feel that yes, this is very, very important, it's going to matter their life, then only they would come forward and approach the doctor. Otherwise, they will put it on second or the last priority, I would say. Thank you.
Right. Dr. Bajaj, how would you rank this Janani Helpline? Because some doctors mentioned here also, if a woman has a health issue, she'll speak to the male member of the family, then she'll go over the grapevine, WhatsApp, friends, family members. One will tell her one thing, other one will tell her another thing, all confused. And then there is this helpline. So what does she access first to get the best benefit? To your mind, what should be the ranking? Dr. Bajaj, would request you to please unmute yourself.
Thanks, Anisha, for the question. See, in India, women, they have a lot of myths, misconceptions as far as their health is concerned. And, you know, if it is a girl, first she will talk to her mother, and a lady, she will talk to her husband, maybe her friends, neighbor, relatives, and they tell their own experience, whomsoever she asks. And most of the time, she gets wrong information. And women, they don't have access to healthcare all the time, you know, because of financial issue, or they are busy with their family, or any other reason. But this helpline phone call is it's very easy to contact a doctor, you know. And so if she contacts at the first moment, so she will get the right information. At least maybe she can visit a doctor later on, and a specialist doctor, she is going to guide her, and she is going to tell her the right thing, what is her problem, and what she has to do next. So I think it's going to help women in a great way, and it will save her from the wrong information and myths.
Right. So this is definitely going to help, and it should be prioritized over the grapevine to get information about health, because best to turn to the experts than, you know, your relatives or your friends. Dr. Vijay Thobi, I want to ask you, you know, usually in our country, people approach a doctor or access medical facility as the last resort, not just women, but overall in our country. And they sometimes even delay their treatment. You know, having a helpline, will it change their mindset? Will they, you know, get a reset in their lives that why ignore when you can get quick answers to anything that may come up as a health issue? It just changes their mindset. They put health first. They don't delay it for, you know, when it's just too bad and the pain is unbearable, I will only go there. Will it help change in mindset?
At the outset, I thank this IHW Council and our leader, Dr. Hema Divakar, from bringing these issues and helping all the people in India, especially women. I think this is one step ahead to empower women to take the guidance. And I do agree that the woman gives the last resort for their health, and they approach very late. So Janani Helpline is going to make a difference in their lives. They can contact, they can maintain their anonymity. Sometimes they cannot express some things to even their husbands or their close family members. But definitely, if this Janani Helpline will definitely make a difference by contacting immediately, they can counsel, they can take the counseling, not only health issues, but also mental health also is very, very important in this COVID pandemic. I do also agree about the various aspects which were discussed by my all co-panelists. And also in this Foxy, all Foxy can come together at their respective areas, those who are interested. Already 150 people have joined in this. And
the cost sometimes becomes an issue, because many we are going to reach the rural India also, and I know that they also have the smartphone, they can be reached, and they can immediately contact the nearest doctor. That definitely helps, and I think it will have a huge impact on even maternal mortality and morbidity as well. As far as about the nutrition, I always talk. The nutrition education or nutrition counseling also can be done through this one app, or talking to the patient. Whatever is available with them in this pandemic, what best they can bring out in their nutritional aspect. What they have many ways. Many times last also in webinar they were asking whether I should eat papaya or not, or I should not eat. And mainly that it is a family atmosphere, family, the whatever things that counts in the woman's health. So Janani Helpline is definitely going to make a huge impact in women's health, I must say.
Right, it's going to make a big impact, and Dr. Hema Divakar has really pioneered this concept. She wants to say something. Go ahead, Dr. Divakar.
Thanks, Anisha. You were talking about the mindset. I think there are two different aspects to this. The mindset of the doctors or the healthcare providers also need to change, because many a times for many of those issues we just push it under the carpet, and they are not getting the suitable answers, so they are seeking some help outside of the medical community. That's for sure. That's how when we say the WhatsApp universities and the Googles are the ones which are educating them, we also have to be in that space of the helpline, and any which way that they can connect to us. So that is point number one. The second is, Shapath talked about the adolescent age group, and I really am curious to see the data when we have segregated, are you less than 20, are you between 20 and 40, are you over 40? I have noticed that in the video consultations, over 40, most of them, their daughters are so keen on checking out on the problems of their mothers, and they do connect to the video call and helpline. So that is a change which is happening. Okay, and below 20, yes, we have tried from Foxy to establish the Yuva clinics, the youth-friendly services, this, that, and the other, but somehow in a mixed ambience, in a clinical setting, the Yuva or the youth do not like to walk into that clinic, and there is so much to do with anonymity, confidentiality, being judgmental, etc., that they just don't like to come there. And also some of the concepts, the newer concepts, today is the World Environment Day, so I would particularly like to mention the use of menstrual cups, where a lot of the younger generation is moving towards the menstrual cups on their own, because they don't have this advice from their doctors. In fact, we recently published a paper asking them, where do they seek information? 85% of them said that it is through the digital platforms. Whichever they don't have an access to the authentic platform, but they figure out from there. Another about 10% is from the peer group, the friends circle. Last 5%, okay, the very last, they say that, okay, we will ask a healthcare provider, or we'll ask the doctor about what this is. Many a times, the doctors, especially now with the single issue of menstrual cups, I can say that all the doctors have opined that it is a good way forward. All of them say that if the girl is already using that, yes, we would say if she's comfortable, let her continue with that. But the last question we asked the doctor was, would you recommend the use of menstrual cups in the young girls? There was a clear, no, I will not voluntarily say so. Let them do whatever they want. If they're doing, they're happy with it. So it's a whole. And lastly, this generation, what we are talking about, they would be probably the bulk which will be accessing this, not only because they're tech savvy, because they have that kind of a mindset, and the time really flies. We as champions have set our base for offering this helpline, which the younger generation now are soon going to move ahead in the timeline to their own reproductive age group and so on. So if this is 1,000 days and continuum thereafter, I think this is a great start for the generation next, that they have at least something to lean back on the anonymous, confidential, non-judgmental, and correct information. So that is how we want to take this whole initiative forward. So as much as the girls and women out there have to do to access us, we also have to work our mindset through to access them in a way that would tempt them to come back to us for more information and get more empowered and take their own health decisions with the knowledge of what the options are. So that is how we would want to take this entire initiative forward, Anisha.
Right. Thank you for that, Dr. Devakar. You spoke about adolescent girls and how this helpline is going to give them authentic, right information. And Dr. Komal, I will be hoping that there will be a mindset reset, that people will think that let's get the verified information first and access the Janani Helpline to get our answers to the questions that we have, and then seek whatever approach is advised. Dr. Chavan, I still want to understand from you, in your experience, when it comes to younger women, adolescents. Dr. Devakar spoke about menstrual cups. They're very new, they're very recent. Their mums may not have used it at all. Now, I call up a helpline and they say that this is a good option for you. How do I go about it? Will I involve my mother? As much as the helpline gives you unbiased, non-judgmental, correct information, how much can that be actionable independently? Dr. Chavan.
Thank you so much. And at the outset, I would like to thank Hema Madam and the team IHW Council for this wonderful initiative. Janani is the helpline, and it is a well thought about initiative for the girls. The name Janani means it is for the young girls who are going to be mothers, the mothers who are in giving birth. And we gynecologists are giving advice to them as mothers, because whenever a lady at any time needs any help, they reach out to mother. So we actually want to reach out to gynecologists who are ready to help them like mother. So very nice, thoughtful name, Janani, and a wonderful concept. And I come from Mumbai city, but it's not that we have this lot of people, as you said, having incorrect information. A lot of Google read people, educated, good class of people, Google read, they get half information. And they have a lot of queries because they read too much. They go till the end. One small problem, they would read till they will go on till cancer or even death kind, or they'll know side effects. So that becomes too much and they get so confused. That is the first thing. And second thing in Mumbai city is that though everybody is a metro city, the females here, most of them are working class. Whether they come from good class or they come from lower class, they are in the urban slums. Most of the women who are part of urban slums, they go to the public hospitals for treatment. And all of them are usually working as a domestic help or in some company and anything. So accessing to women's health, they really require a day off. They have so many queries. So that laid back attitude is there, going with somebody, having a friend, not revealing, hiding, and then they come late. So the information, or even there are a lot of places where at some slums where there are not registered practitioners. What we call them, they are not the actual doctors, like the gynecologists. Forget gynecologists, they are not even MBBS doctors. So there are some BHMS or some doctors who work as family physicians. So when they get information from all that, they get really confused. So Janani helplines will be a filtered information which will be given only by gynecologists. So that is the beauty of this helpline, because everything is going to come from the experts who are gynecologists, not even the MBBS. So there are people who rely to all those BHMS or the general practitioners for information. Then people who rely on Google and get half information, and they come with so many queries. So that all, whatever that problems we're encountering in that level will definitely be overcome, because when we say that it is by the gynecologist for all the women, definitely that is the USP where everybody will like to contact Janani to get the right advice.
Definitely having on board so many gynecologists who are giving this advice free of cost, free of judgment is really welcome. Dr. Varma, in your practice, who do you think will be most amenable to calling up a helpline as the first resort? Not checking with family, not checking with friends, not Googling, but going for this helpline. What kind of women would these be who will first dial this number? And do you think that this helpline will be a success in rural areas? Now, in rural areas, homes may not have electricity, but most homes have at least one mobile phone. So, what do you think? Who will this service be most popular with?
Yes, thank you very much. First of all, this concept of helpline, and that too from a gynecologist expert, this is definitely going to create a magical impact, and a great miracle is going to happen. And I'm 100% sure nowadays that the word rural is going to be completely removed, and all the women are really empowered, and how they are doing so well. Even the COVID has proved that the rate of infection, rate of their everything recovery has been wonderful in the rural public. And this rural public, they have got all the facilities. Like I belong to this village of this Uttar Pradesh, and it's unbelievable that they have everybody in every home. There is everything. I was amazed to see when 5 years back when I went, the things were really very different, and now it is really very different. Everybody's having car and everything. This rural concept is rural because they are having agriculture things, and they are everybody, almost 95% I can say, they are having that good kind of a phone. So they have, and they love to talk. Women love to talk, and whenever they are, and in this pandemic, they are having lot of anxiety and stress because their emotions are all pent up inside, and they want to talk to anybody. And who else can be better than a gynecologist? And that to a Janani. Unko sakhi bhi mil rahi hai aur Janani bhi mil rahi hai. I think it will be a very, very nice concept, and we need to make all these train and somehow. There's a local helpline center also, and when it becomes recycled, of course, and filtered messages they coming to the gynecologist, that will be creating more awareness and more wonderful impact. Like all everywhere, there are always 3-tier system. The government also, they made a wonderful scheme for the pregnant ladies of the rural, and they were all booking online, and they were getting all injection, and they were all getting call from, you have not come for the tetanus, you have not come this. And so in this, when we are giving them a stay safe, stay healthy, and social distancing, so this is going to create a good effect. And जब vision इतना अच्छा है, तो उसका result भी अच्छा होगा. So I think it will be good enough. And Uttar Pradesh especially, I think I belong to NCR public, and they're all the Haryana girls and all the UP girls. They are as Preeti said. But I think the main problem was when they talk, they are in a room, and they know कि कोई सुन लेगा और ये ऐसा हो जाएगा. So that was a little problem beforehand. But now हर किसी चीज का कुछ ना कुछ तो एक लास्ट में पता ही चल जाता है कि अब क्या होना है. तो फोन का उनका रिचार्जिंग नहीं हो रहा था. So many problems were there. And अब उन सबका सब धीरे धीरे they get used to it, and they are doing. And because in COVID times a lot of problems was there regarding management, and everybody was worried, and the women were at the back step. Now again they have come the front line of a house, and everybody is with a phone, and everybody talking. And so we'll be doing it. They're more concerned about less concerned about contraception, more concerned about the abortion pills, and that too after taking the pills, and then they consult. And so that is a main thing. And menstrual cup, I think it is creating waves, and all the news media people, because in 2018 when I first introduced menstrual cup to the Foxy, I can give in writing 90% of the doctors were not using, and they were not knowing it. And now the things are really very, very different. And Dr. Hema will be the best person who can make this possible, because menstrual hygiene is really, really one thing. Because in pandemic, getting good hygienic material for their menstrual hygiene is really a source of concern. And when they are getting it, and there should be sanitation and good water supply and good disposable, and we'll be doing much more work with Dr. Hema will be doing, I think.
Right.
The government also, madam, even the government is saying that this sanitary, they are giving free vending machines and incinerators also, and they are waiting for somebody to take them and make them happen in the schools and everything.
So, right, a lot of work being done simultaneously. Dr. Buyar, when you have access to the Janani Helpline and you get the correct information first, then what happens to all the myths that are passed down generations? And if those myths are reduced, what is the impact on the practice of doctors' life?
No, I think, in fact, now this is almost 3 decades of my practice. I have the experience of, I always believe in educating the people. I won't say it is my way, but I think it should be the most helpful way, being transparent with the people. Educating the common people helps you better, because as it is, they're going to take their education, whether correct or incorrect, from the Google or their friends. So it's always better that you educate your people so that, they become more cooperative. They get involved in making their informed choices as well. So that's the very reason, if you educate them, give them appropriate information, help them making their decisions, it will be always good for you as far as the outcome is concerned. Whether it is health related of the mother, baby, and whatever otherwise also, it is also equally good as far as the litigation part is concerned, if you are talking about your individual practice. As far as this helpline is concerned, as we have said, whether it is rural or urban, this is Digital India, and it has reached to the rural part equally well. So there's no question of rural and urban segregation or discrimination. So giving correct information from the experts who has the entire, rather correct knowledge of that subject, and when you're giving the information free of cost, you are giving correct information in a non-judgmental way, you're giving it in a confidential way, maintaining their privacy as well, and it is straight to the person, the target person. So I think it's the best, and that's how it's going to help you. At the same time, doctors are giving free of cost services. So we are not the part of it's not going to be liable for CPA. So doctor will also be totally free to give their services in the form of advices which are correct, appropriate for that particular person. So the patient will be free of her fears, and the doctor will also be free of the fears. So I think this will be the best possible help, we can say, the helpline, Janani. Thank you so much, madam.
This definitely is a win-win for the doctors who give the advice and for those who are seeking the advice. Dr. Sonia, I want to know that what happens if people, women start accessing the Janani Helpline, they get the right advice, then what happens to all those myths that have been perpetuated over lifetimes? Will they reduce? And if those myths reduce, does the life of a doctor become easier?
Definitely. Now the present situation, after all the panelists have actually spoke about, there's one thing which I want to tell is today's girls are very expressive. Indian society is conservative, but the girls are very expressive. And 60% of the women are there who are not actually comfortable in opening up and speaking to their own friends, relatives, and family members. In today's era, we also have to know that single parenting is in too much of high incidence. And if we have to check, in rural India, there were Google's and Tata Trust. I was just checking the statistics about in 34 million women, they have introduced internet. This was in 2019. So that was 2 years back. And about 200 million women in the country are illiterate. Out of them, they actually started the Internet Sati. This was an internet friend program which used to train the rural women to become digital pioneers. This was in 2019, and this was solely to run their business, to connect and communicate. If they're doing business by introducing internet satis, why not we use this digital platform? And then, of course, when all the panelists have already told about this is free of cost and professional voice out for their problems, day-to-day problems. It may be a single parent, so she cannot voice out, she cannot talk to a parent, or it can be some issues where there is a problem with the partner, she cannot ask anybody, and it can be most of the time when we are giving them phone consultation, it's usually contraceptives which they have a lot of doubts. There's some issues with the vaginal infections which they can't reach out to the doctors at that particular time, but they don't want to neglect that. There may be a lump in the breast, she is anxious about it, but she is unable to reach the doctor on time. So maybe we be a friend to the caller, we listen to them patiently, and of course she will have a kind of an advice where tomorrow or day after she has to reach to doctor in person. We are not neglecting that, but we ensure them that there is an issue and we sensitize the issue and see to this for that time being she has some relief, so that tomorrow she has a friends or anybody else also to probably take an advice through this helpline, Janani. So
Right.
definitely it's a blessing. It is definitely a blessing. And I'm saying this electronic empowerment of the women is the next step, Janani.
Right. Dr. Charmila, this whole the digital world, seeking information digitally, and seeking healthcare professionals digitally. This used to be there years ago, but has suddenly become the go-to because of the COVID pandemic. At a time when people are scared to step out of their homes and contract the disease, they have been using telemedicine. And do you think now, because of the experience during this pandemic, people will access this helpline, women will access this helpline more wholeheartedly?
I think so, because when you think about it, women may not be educated as much as men in our societies, but they embrace technology when they are taught to, and that we have seen also. And when you counsel them person to person, sometimes, as I hear all the other panelists say, there's a hesitancy. But when it's anonymous and you talk over a phone call, they may find it much more easier to talk regarding their problems, which they've actually not thought about at all, but it has got a significance somewhere. So when the anonymity and you don't see the person whom you're going to talk to, I think it will create an impact, because women are brilliant when they thought something and they take it forward, and we see that they access it much better than men when it comes to themselves and children, if they're told that it's anonymous and they'll get the best advice possible through a helpline. And when it's manned by gynecologists who's going to give you a sound advice, and when it picks up, I think it will go forward for a long period of time. And COVID has definitely helped in that way, accessing technology when you need it.
Right. Dr. Jayam Kannan, do you think this is a far better way for the digitally connected people to reach out for the right medical advice? Because honestly, it's the first thing one wants to do is do a Google search and find your answers. So can this replace that? It's now become a reflex instinct to go to Google and find out the answer. But perhaps this should be the reflex.
If you ask me good, better, best, yes. direct contact with an obstetrician through this platform will be the best. Getting anything Googled is better. Maybe taking it from a doctor directly is good because it becomes an individualized opinion. Whereas when it goes through this digital platform, the doctors who are joining in this digital to answer are all experts. We can't expect a patient to go to a nearby doctor who may not be a gynecologist or may not be a gynecologist well expertise. Maybe the family doctor who may be regularly treating from cough cold down to uterus. From top to bottom, the treatment will be given. Whereas here, we are concentrated more on menarche to menopause, inclusive of pregnancy care. That means we are highly focused. So with this focusing, our platform will be the best platform. And I really long to see a patient giving me a call in this platform from today onwards.
That's a good start, and let's hope that this really kicks off well. Dr. Sampath, what change do you anticipate amongst patients now? If they have access to the right information, what kind of changes do you anticipate in patient behavior?
What's the change in the COVID era?
No, ma'am, what kind of change do you anticipate in the patient behavior? If they have an access to, trained gynecologist on phone, what kind of changes can we expect from patients in their behavior?
Yes. This is one best thing is all of us are gynecologists. See, I can tell only one example. See, now if a patient, she can be an adolescent or reproductive or whatever age, if the patient comes with a history of no bleeding for 2 months and now starts, she wants some, if she is coming to the gynecologist means, if the patient with amenorrhea and bleeding, we will counsel her to go with a scan and everything. If the patient of an abortion history, she is going for termination with medical tablets, sometimes she may end up in ectopic. Ectopic is the baby which is outside the uterus. Since we are gynecologists, we will have some limits. So this will be definitely useful to the patient if whoever is having the platform. So with this platform, as all of us told, we can avoid the complications which can occur. And in some cases, some antenatal patients, they would not have come, as Dr. Preeti was telling, they didn't come for a checkup or everything. In that case, they can go for anemia, even to the programs with the phone. In that cases, with the platform, it can be increased. If they are not able to come, we can advise about the diet and what are all the diet they should take, which will improve the hemoglobin. So with this Janani Helpline, definitely the women's health will improve from, as I told earlier, again, from adolescence to menopause. So the adolescent, as I told, they have a lot of doubts. As Madam told, this May 28th was Menstrual Hygiene Day. I had a talk with one of the college students in Chennai itself with online only. Lot of girls, about 40 to 50% girls are aware of menstrual cups. I think as Dr. Archana told, though it is there for 5 years, only doctors are not aware of menstrual cup, I think. Adolescent girls are aware of menstrual cup. So as we told, we should also have it as Madam told, if she is using, we will tell you can use. Otherwise, if she is not married and if she is asking whether you can, I can use the menstrual cup, we will be in a dilemma what to tell, whether to use or not to use. But if the application for menstrual health is easy for her, definitely we can tell that she can use the menstrual cup. Nothing to talk about hymen and all. Now even the POCSO Act tells that don't talk about hymen. So this helpline will be definitely useful for everybody. Thank you.
Right. Dr. Preeti, what kind of changes do you anticipate in patient behavior? And do you foresee any limitations in this helpline? Like you said that 3 lakh women have dropped off into institutional care because of the pandemic. You can give the advice, and after, maybe the patient needs to see a doctor in person. So do you think there'll be a drastic change in patient attitudes, and where do you think could be a few limitations in this Janani Helpline?
Thank you, Alicia, for putting up that question. I think everybody endorsed that Janani would be the best helpline for the women of our country. But still, I would feel there would be some challenges. And as we roll out this Janani Helpline, we will face some challenges definitely, and we will definitely try to figure them out, and we'll try to work on that. What my personal experience as in UP had been that whenever I used to get calls from the husbands also. Sometimes the husbands of the patients used to call my husband. He's a physician. They used to drop him a message, and then inquire. Then he used to ask me. And then this kind of thing used to go on. So in UP, there are some kinds of, I think there are challenges when we cannot just directly contact the patient itself. So sometimes the mother-in-law calls up, sometimes the husbands call up. So these kinds of challenges are there in UP, at least I can say about UP, not about the other states. But there would be some challenges when we talk about the rural areas. Definitely in urban areas, there would not be any problem because we are regularly in contact with these women and maybe adolescent or reproductive health, or as Dr. Sampath said, we will definitely try to bring down the complications. But in rural settings, provided there is a demand, there's a teaching, and there is a, there is a mindset change. What Dr. Hema said, there would be some challenges here. I think this is my personal this thing, because during the COVID we used to get a lot of calls from the husbands talking about, क्योंकि उनसे बात भी करो अगर वाइफ से तो कहते थे एक बार मेरे हस्बैंड को आप ठीक से समझा दीजिए. So this kind of thing happen. So this is a practical problems.
Right. Dr. Bajaj, do you anticipate a change in patient behavior? Because of this helpline which is available, how does that impact your life as a doctor?
See, definitely there will be a change. And as Dr. Preeti said, we also face the same problem. And my husband is also a physician, and he gets call, is normal delivery possible for my wife? Even patients come to OPD, and women, they don't talk much. Mother-in-law is, or husband or somebody else is talking on their behalf, But everybody is phone friendly, and everybody has a phone and a smartphone. So I think they are phone friendly, and as the call is anonymous and it is confidential, so women are comfortable, and it is easy to access, and it will bring a lot of changes. But definitely we will have limitations, challenges, because we don't know who we are talking to. Call is totally anonymous. We don't know her mindset, we don't know her background, and most importantly, we don't know her resources. And next thing which comes to my mind, that there is no arrangement for follow-up with the same doctor, as it is a free helpline. So I don't know how it is going to work when it is start. Let's see how it works, but there will be challenges.
Yes, Dr. Anisha, I just want to point out what Dr. Ekta has said. How would you filter out those fake calls from those helpline? Because there would be some calls that may come up.
I don't know about the
Dr. Hema would be better to answer those questions, I think.
You want to come in there, Dr. Devakar?
Because we said that, all of the champions here are very mature enough to recognize that there are two sides of the coin. Most things are going to be good because the intent for establishing this whole helpline is towards doing something better for our girls and women. But yes, we are realistic. We acknowledge that there will be challenges. And therefore, we've said after a month, the same team is going to meet again and discuss and document what would be the way forward to overcome these challenges. These should be seen as opportunities for us also to learn about the patient behavior, about the trends, about how we should be responding to them. So it is going to be, the challenge will turn out into a great learning opportunity for us as well. And yes, the fake calls may be there, but we are at liberty to just cut the call, because I think even if it's anonymous, even if we are not seeing that person, the kind of tone and tenor of the conversation, we can kind of, we're not comfortable with what is going on. We just cut the call then. That liberty is already, given to all our specialist champion for sure. But more often than not, for 9 out of 10 calls, if I just have to keep the number of 10, 9 out of 10 calls would be genuine, because we are, going to plug that intent of that. If one prank call is there, well, there are all kinds of people in this world. We have to acknowledge that as well. So we cannot, paint a picture which is very, very rosy, because there are going to be. And then we in clinical practice also have some over smart and very, annoying kind of patients who would just, even they don't even speak eye to eye. They have an air, with them, and the way they question you, and in a condescending manner, in a ridiculing manner, that that they know it all. So we've learned to be patient. We've learned how to tackle these kind of situations. We have to be firm as how we are in our routine practice day to day what we're seeing. So I think these will come up, and if there is a large percentage of these coming up, which I'm not foreseeing, we will have to figure out a way to overcome that as well. And as how we said, the technology is ever advancing, and we may be able to get the, there are some channels where they show their Aadhaar card and, their face and this, some identity is there, some authenticity is there, and then they move forward. So we don't know whether that would be really necessary or not, but these are genuine concerns. And I think as we move ahead, from mother-in-law to husband to directly to the girls and women is our intent, and I think that's going to happen very soon. Yes.
Definitely. If, women can directly, reach out and speak to a gynecologist and get answers to her questions, is definitely...
Anisha, can I say something about this issue?
Yes, please go ahead.
Even when we are dealing with the direct clinical practice, we do face some kind of situations like this, where the husband want to, if I give the example of this COVID times, where we try to limit the number of people coming to the chamber. So we just talk to the girl or the woman, and we send her explaining everything. After some time, the husband will say, I want to meet madam, once again alone. So, this situation you are directly facing even with the direct consultation as well. So, what we have to do is, first and foremost, wherever you need to face the husband, you face them together. Where you can't avoid, you make them sit and talk to them together, even in this situation. If it is for a phone call, I would say that when we are talking to the woman, if at all a husband calls, we can say, yes, we are talking to both of you. You can just hand over the phone to the wife and put the phone on speaker, so that, both of you can listen to it. You also can have adequate information. If the husband feels that he is smarter than the woman, I think we can tackle the situation in this way.
All right.
And of course, as madam has said, we can definitely cut the call if we are not comfortable. So I think that should be the solution.
Dr. Shapath, if women are able to reach out and get answers to their questions directly, do you think it empowers them? Because they get the right answers, they feel more confident about their health. They may feel more confident overall. And because of this empowerment, we will have better health outcomes for them, for their families. Do you think there is going to be a trickle-down effect as well? Dr. Chavan, the question is for you.
Yes. Regarding the same, what we were discussing, because now this is a Janani Helpline. There is a difference, I think, should be a helpline and a consultation. We are not looking for a complete consultation, because there are so many questions which come to a patient beyond a consultation. Because if a patient comes to me for some matter of a white discharge, she may be having a menstrual problem also, which she has never approached a doctor, because she has come because she found that white discharge may lead to cancer, but she is ignoring the menstrual. So that one time they start asking so many questions. So the helpline will be all the n number of questions which the lady has in her mind rather than the consultation. Because what issues need to be tackled in physical, or the more questions which come into everybody's mind, then probably that person should be encouraged to visit a doctor, because they may not be revealing the entire history, because taking a complete history and having a picture may be one of the thing where we would miss out something, because they may not reveal the complete history. Sometimes they feel very ashamed to come out and tell that this must be the problem, or I had this problem earlier, because there may be some relative accompanying or some friend accompanying, and they can't tell completely safe. So what happens is that when there is a helpline and it is totally anonymous, they can actually tell all those history, and we can actually guide them. See, you have this problem, you can go to a doctor, or this is not a question of worry, you need not worry, or you observe for some time, and then you can later on approach a doctor. So that power we can give. So a lot of this question, and during COVID times, what has happened is that everybody has shifted to online, whether it is metro or now everybody knows what is online. Even the news reporter, even small things, everything is becoming digital. Even my maid will do a video call and talk to her grandchild in a village who are in the remote villages. So the video calls and the phone accessibility is for everybody. Even if they're whatever poor, every family member has a small phone. Not about smartphone. I'm talking like people have smartphones. Even the small phones, everybody has, whether they are daily wage earners. So making a call, and all these call companies have packages of phone outgoing, incoming free. So this is very important, that when the helpline becomes very, very prominently displayed, and everybody knows that this is a number I dial and I get answers to my simple queries, that should be the beauty of this helpline.
Definitely. Dr. Archana Verma, you said that, and doctors have also mentioned that women are very expressive. Their families or their societies may be a little repressive, but women are expressive, and they want to seek out help. So, like Dr. Chavan said, that the anonymity makes them reveal everything. Their entire history will be known, and hence the advice you give will be correct and absolutely unbiased. So if the patient needs to approach a doctor physically, then you think that same forthrightness or the truthfulness will continue, and she will get the right treatment because she reached out to a helpline where she was completely honest.
Yes, actually, this is almost this helpline, I think, is giving them that confidence. It's a building of confidence. The symptom they are having is curable, treatable, and they are not going to die from it. I think that is the only, and they take time. उनको they beg the time, और एक टाइम लिमिट मिल जाता है उनको, प्लस एक अपना जो सबके माइंड में क्वेरीज होती हैं हर चीज के लिए. सपोज जैसे उनको जस्ट लाइक शी इज सेइंग पेन इन एब्डोमेन है, so so many patients, even they are coming 3 times a day, still they have queries for the delivery also, and for the everything. They are never satisfied. You write a prescription, 4 times they call, morning में tablet लेना है, evening में tablet लेना है, तो वो एक concept तो रहता है lively, और उनका direct जाके physical examination से again they feel satisfied. So one thing is a confidence, second thing is a satisfaction. So satisfaction they will only get if they are get checked up. So that thing cannot be done on phone or helpline, but definitely 70% work will be done when they are going to see the patient. I think that is. Madam, मतलब बाकी I think it is clear what you asked the question, Dr. Anisha.
I'm not a doctor, but yes, Dr. Verma, I got the answers. So, now we come
Madam, just 1 second. I want to just say, we want request to Dr. Vidya Thobi for this online suspicion and all the queries. The very famous poet Dushyant Kumar ji, तो उनकी एक poem है. यह जो शहतीर है, शहतीर is a big bam, जो मकान बनाने में लगाते हैं. ये जो शहतीर है, पलकों पे उठा लो यारो, अब कोई ऐसा तरीका भी निकालो यारो, दर्द दिल वक्त पे पैगाम पहुंचा ही देगा, रहनुमाओं की अदाओं पे फिदा है दुनिया, इस बहकती हुई दुनिया को संभालो यारो, कौन कहता है आकाश में सुर्राख नहीं हो सकता, एक पत्थर तो तबीयत से उछालो यारो.
Thank you for that poem. It's hit with our doctors here. Now we're coming towards the close of this show. So I'm going to take the last words and short last words from all of you. Dr. Charvera, would you recommend this helpline to all your patients?
Yeah, we will do it because we know that in the COVID era, meeting a doctor face to face is very difficult, and we're going to get an explosion of cases here. So we'd not recommend it at the first shot. So it will be a screening method for them. Talk through the helpline, know whether you want to reach a doctor at emergency or you can wait for a few days. That help you'll get from a specialist gynecologist who will tell you the right thing to do at the right time. And that will be very helpful when COVID is just being like, it is more than a pandemic now. It's taken the life toll of mental health also. So it will be a very great tool as a screening method to find out what you need to do before you approach a doctor and when you should approach. That will tell the correct timeline to wait or do it at once.
Right. Dr. Sonia, how do you think the uptake of this helpline will increase? Would you advise your patients? Would you talk about it at general gatherings? How do you think we can, popularize this helpline?
Definitely. I think after this COVID era, we have started COVID helpline in our local cities. This has started with a bang, and everybody is used to the helpline numbers because the phone is in their pockets. But one thing what we have to make sure is this is just a helpline. This is not a consultation, as rightly Dr. Komal put it across. And as Dr. Charmila said, it is just for the mental relief. And this is the first step so that we guide them and ensure of their health. And definitely this is going to go a big way. And congratulations to the entire team.
Dr. Preeti, your last words. How to get more women to dial in without inhibition?
So my next, Anisha, step would be we'll be displaying this number in our clinics. Request all the logs members to display this number in their clinics and try to promote as much as possible because we need to reach out to millions of women of our country.
Right. Dr. Sampath Kumari, your last words.
Is whether counseling or screening, whatever it is, if it comes from the words gynecologist means, all patients will be convinced. So it will be really helpful. After that, we can think about that treatment.
Right. Dr. Kannada, your last words, how to make this more popular, how to make this the first go-to for women who may have an issue with the health.
Yeah, this is a platform with the right person, with the right answer that gives them clear their cobwebs and that makes them decide the next step, their way forward. So it is definitely going to be a true tool which has been very much lacking from the medical platform, especially of gynecologists. So I really feel and appreciate Hema for this hard endeavor and make it proper. And we all will be there at any time of the day for this answer.
Thank you so much, ma'am. This really inspires so much confidence amongst all women to reach out when they know that, somebody is there to hear them out and give them the advice that is correct for them. It's coming from the best trained people, the correct specialists that they're reaching out to. Dr. Bajaj, your ideas on how to make this popular to ensure that, the uptake really improves and it becomes a big hit quickly.
Yeah, I think as Dr. Preeti said, we can display this helpline number in our OPDs and we should spread in our friend circle, our gynecologist friend and different gynec society. And I think it is a digital connect. So best media will be a digital media to promote because everybody uses Facebook, Twitter, WhatsApp. So digital media is the best media to promote and spread and to make people aware and to reach maximum women as far as possible.
Right. Dr. Vidyasobi, your thoughts on how to make this helpline
Yeah.
popular?
We are reaching the unreached, so we can make it more popular as we have all the various webinars we are conducting, so we can make the people aware, means doctors first, that such a Janani helpline is available, so that we can reach to the various consultant who, as Preeti was telling, we can display this helpline. Secondly, we are talking through Akashvani, Radio Kenras, or any TV programs also. There also we can put one small line that the Janani helpline is available for consultation. Because many of us, we are talking on various programs of awareness. So that reaches out very well to the public whenever they are seeing any TV programs or any, they are listening to some health programs on Akashvani or anything. So this is going to hit the bottom line, and definitely it is going to help all the people, maybe urban, maybe rural. Definitely doctors reaching out to help the people is really a great step. And it is the first, and so many things are going on. We are not, means we are running the help desk, we are all doing telemedicine or video consultation as well. So for doctors it is not new, for the people to approach it is little new, but I think definitely it is going to help everyone in that matter. Thank you very much for making me a part. I immensely thank Dr. Hema Divakar, IHW Council, and others StepOne people for this journey, a different journey, of course. Thank you.
Thank you, Dr. Sobi. Dr. Puyar, your ideas on making this a very popular helpline. We've got ideas of digital media, mass media, word to mouth. What do you think was best?
I think everybody has said it all. I just second it. Expert gynecologists across India, just a phone call away, and we give the phone number. I think that should be all. Thank you so much, Hema Madam, for making me the part of this, and hearty congratulations to the team once again. Thank you.
Dr. Komal, how can we make this popular with women of all ages?
Yes. See, we usually have these younger people more active on the social media. So social media would be a very important platform to get this youth. Because what happens, the youth, when they know, they also go out and tell in the family that there is some helpline to their people. Because most of the time when they go back home, the elders also learn. So they will tell. So social media would be really very important. Nowadays, everybody is doing online lectures, online classes, and a lot of online stuff. So being on a WhatsApp, because WhatsApp was something which was giving a lot of half knowledge, or some WhatsApp university. People used to have a lot of discussions on WhatsApp group, because females, they like to forward, like we usually doctors, we avoid to be part of such groups, but they have an admin and keep forwarding, and they give, and whatever the admin says, that becomes precedence. So giving it forwarding on WhatsApp, because I think everybody's on WhatsApp, would be really great for females. Usually, even if they're homemakers, they're all on WhatsApp. And sharing experience, later on when we have this helpline working, sharing experience of people who have approached the helpline and how they got the messages would be a second step, in which somebody contacted, they got an answer, and the reply was so satisfactory, and because she is getting it, I will also get, and my problem will be solved. And like radio and all, that is also very good suggestion. But even a small video of a patient's feedback, that will definitely go ahead.
Great, great ideas. Dr. Verma, I'll come to you last. Your few words, last parting words on how to make this a very popular service.
Yes, please repeat the question.
The question is, how do you think this helpline will become popular amongst women of all ages in our country?
Now, I think to make the anything visibility is one thing. How can we do that? So if we make a little bit of e-banners and kind of a things, and put it at all the, especially at all the medical centers and all, because the sometimes they are the only place where the people see them quite properly, and this helpline. Like even with the TV, and also if there is this a promo we can make, then it, or in the newspaper, local newspaper, if it is sent, then it will be very helpful. This helpline will be very helpful. I think that the idea is to make it popular, and its visibility is to all, and this number everybody knows. So it that is the only thing.
Actually, Archana is a public awareness champion. She's a champion. She's a champion of public awareness, and she's got many records to her credit.
So we will
Anisha, to add on, Anisha, can I just add on? I think we can have slogans in the local languages and then promote. We have NGOs and a lot of other societies, especially targeting the ladies club and the ladies inner wheel club, or the Rotary club, or the Lions club. And then we can actually promote this in our local radio stations, because it may not cost much, but then we will
the reach will be high.
out to the, and if it is in the local language, they will know that this is also addressed in the local language.
Yes, great suggestions from all of you. Dr. Varma, we hope you will keep the flame of the public outreach plans the highest, and ensure that this becomes popular with all your patients and the people you come in contact with. And a big thank you to all doctors for joining us here. This is a great start, something which will be magnanimous, will be momentous, and will give a lot of empowerment to the women in our country to take their health in their own hands and not feel ashamed about it. This will certainly change the lives of many women in our country. Thank you all for joining us.
Anisha, one last thing I want to tell my champions and all the viewers, that the scale of this, as it grows bigger, we will definitely need more and more and more and more number of champions to come into our fold for this cause, because as of now, in the COVID related, StepOne is taking 85,000 calls per day. You know, that's the scale of the initiative that has built up over a few months. So with millions of girls and women out there, I'm quite sure that there will be escalation in the demand, and with all the public awareness initiatives that our champions have placed forth, it's going to have a cascading, magnifying effect, if I may say. So at the back end, you know, the first group of champions, after we meet at 1 month and rediscuss and put ourselves on the right track to share our experience and the lessons, I would really, really urge many of our friends and colleagues who are specialists to join hands with us and reach the unreached, from innovation to implementing, to make an impact for the healthcare ecosystem of this great country. Thank you so much, everybody. Just thanks is not enough, but that's all I can say at this moment. Thank you.
Big thank you so much. All the doctors for joining us today, and 3 cheers to success for the Janani Helpline that lies ahead. Thank you all for your contributions.
Thank you. Thanks, Anisha. Thank you, wonderful moderation. Thank you so much. Thank you, everyone.
Thanks, everybody.
Thank you, Hema. Thank you,
To take
everyone.
your leave, stay tuned to the IHW Council page. To follow us on Facebook to get the latest updates on all that affects your health and well-being. Stay safe, stay well, and goodbye.